Demand for aged care is surging as seniors now make up nearly 20% of Singapore's population. To tell us more about this, we have Easy Bala of the Alphin Group, Janice Chia of Aging Asia, and Lim Chui Foon of Exobionics. Starting with Easy, what's currently happening in Singapore's aged care landscape?
Singapore is age to nation, and probably within the next year or so, early 2026, it's going to become a super aged nation, which means that more than 25% of Singaporeans are going to be 65 plus, which is a huge milestone. Probably, I think, we all need to be really kind of feel so proud that, yes, definitely lifespan is getting, expanded forever. But at the same time, along with it, we are also kind of having, additional responsibility or increased responsibility to take care of them, to, care for them for good, and pretty much kind of help them to age in place as much as possible, as healthy as possible.
I think it's covered that. I think the future is really about aging in place. So what the healthcare systems are really preparing for is not just prevention of falls, but also moving towards a point where we can get the citizens aging more actively and staying healthy longer and reducing the number of incidences.
Well, I think for me, the most exciting trend is really the technology advancement that we're seeing in this space. So these new emerging technologies that are completely and can completely transform aged care. So robots can now handle more complex tasks. They have greater dexterity, and they can communicate in a natural language. So we're starting to see more and more robots actually being developed to help with care activities such as feeding and temperature taking. And I know a nursing home here in Singapore that's using robots to do group exercise. So how amazing is that? And in my company, Exobionics, we build exoskeleton to help the elderly patients who can't walk to stand up and walk again. So they could be patients or elderly who, had been wheelchair bound for 10, 20 years because of stroke. And now they have the chance to regain the ability to walk again. So that's completely life-changing.
But what's AI role in all of this? Can AI shift aged care from a disease-focused model to a more holistic approach?
Currently, when we say data, every single blink of our eye, every single breath, what we take is all kind of considered as data, and we are generating tons and tons of data on a daily basis. To process all these data and make sense of it, definitely we require a huge system like AI, which definitely kind of puts all of these together and makes sense of all the data, which otherwise humanly impossible, right? We cannot kind of make sense of anything, whatever is actually kind of coming out as data in this modern world with all the technological devices what we have to kind of augment our human capabilities in kind of providing care to not only elderly but for general population as such.
I think the most important thing about AI is the predictive analytics tools that can help. It will help to prevent hospital readmissions. It will help with the partnerships. And AI really should augment human care, not replace it. But one of the most important challenges in the use of AI today is the ethical use and the data privacy. And if we can resolve this, then the solution is going to be very robust, and it will also help to provide more practical care for our seniors.
So with AI, we can reduce variability in terms of the clinical work we do, which meant, we can simplify clinical decisions. We can also lessen the burden of specialist resources. And so all that, together meant that we can now extend care and clinical work outside of hospital to the low acuity sites in the community and in home. An example I would offer is rehabilitation. So we know that patients or elderly, when they go home from the hospitals, actually they stop rehabilitation or doing any physical training. That's because it's hard work. It's really hard to mobilize someone who's weak, with your bare hands. And of course, there's also a lack of a therapist in the community space. But with robotic exoskeleton, the robots can stand the patient up and walk the patient safely. And they can do this with precision, and with quality.
And given that AI is still in its early stages, what safeguards do we need to ensure so that AI in aged care stays fair and accessible for all seniors?
So when we talk about seniors, so seniors have or are actually kind of keeping pace with the technology. So they're also kind of tech savvy nowadays. So when we actually kind of monitor them 24/7 to augment the caregiving or the caregiver, to kind of constantly monitor for every single untoward incident, whether they are awake, whether they are in their private places, or where they are asleep on their bed, continuously kind of monitoring. So it comes with it the responsibility of really kind of maintaining that privacy, as Janice actually kind of mentioned. That's the most important thing. Like, we need to really kind of maintain the privacy of the person whom we are actually kind of giving care or who's being monitored. And the second thing is also pretty much kind of make use of those data for really kind of, understanding the overall kind of health, and also kind of projecting and protecting, anything which is going to be really kind of happening in the near term, and thereby allowing all the caregivers to kind of intervene early and pretty much kind of almost stop all those untoward incidents that are going to happen. So the key here is to really kind of make sure that the privacy is really maintained always, and the data is actually kind of used for better kind of outcomes.
One of the main things is the knowledge. The public needs to know what is the data going to be used and collected for. And I think that comes to data transparency. So I think as long as users are clear about the use of the data and how it enhances their healthcare journey, it's going to be fine. Today, we have to accept that the use of technology has also overlapped every part of our lives. So, the use of data and AI in aged care is no different. But I think it's about the client knowing and about the healthcare providers being able to explain in a clear and transparent manner.
For me, the bigger ethical dilemma right now is how autonomous can or should the AI be, especially in the recent weeks where, there's so much excitement in the AI world with the rollout of AI agents. So these AI agents now have the ability to analyze, to decide, but also to act autonomously. So the key question now is, of course, it's great for efficiency, for accessibility, but to what extent do we need to keep human in the loop? So it's really a question of accountability. And ultimately, in aged care, we really want human to have the accountability.
Thank you so much for joining us today and for sharing your insights, Easy, Janice, and Trifun.
So much says.
Thank you.
Thank you.
Once again, those were Easy Bala, founder and CEO of the Alphin Group, Janice Chia, founder of Aging Asia, and Lim Trifun, CEO of Asia Pacific at Exobionics. For more news, visit healthcareasiamagazine.com.